Good morning. Welcome back to Daybreak. It's now 12 minutes past 7 o'clock on this 21st day of July 2020. You're watching Daybreak, and it's time we take some focus on the counties and how they are handling the coronavirus pandemic. But before we do so, I want us to take a look at what guidelines that were released yesterday by the head of public service, that is Joseph Kinyua. He sent these guidelines reminding people that they need to continue avoiding congregations. He was saying that there has been some ignorance in terms in as far as the public servants are concerned in some offices. He says that the workstations have to be rearranged to ensure that the workers are sitting in between them. There's a distance of 1.5 meters. He also said that moving forward, there will be older and ailing public officers will not be required to report to work. Those that are aged above 58 years, those that are in job group S and below, that will be affected. And also those people that, those officers that have pre-existing conditions, they are being told now they have to work from home to make sure that they stay away from the infections at the office. Then organizations have to provide masks. They have to provide soap and water or hand sanitizers for workers. They have to do regular cleaning of common places. And also they have to fumigate offices, vehicles and washrooms as regularly as possible. And then also they have to sanitize all incoming mail or documents. So should you send a letter to an office, it has to be sanitized before it has been opened. But also they're encouraging, the head of public service is encouraging that people send emails instead. Then they have to avoid contact with persons who are depicting cold or flu-like symptoms at the workplaces, just to be sure that you're not exposed to someone who might be having the coronavirus disease. Then as far as working from home is concerned, the arrangements have to continue, especially where they have already been entrenched. There have to be clear targets that are set for the staff that are working from home. There has to be clear deliverables, and there has to be a weekly duty rota to be drawn for the personnel that needs to be at the office, and they have to be kept at minimum. This is in as far as advancing the desire to decongest the workplaces is concerned. And then also for those working from home, they have to obtain well, this is not actually working from home. These are people that may have contracted the virus or have been in quarantine or isolation. They have to obtain clearance from the respective facility. Should you have been in an isolation facility or a quarantine facility, you have also to stay away from work for 7 days after you've been cleared to go back to work. So just to make sure that you stay away and make sure that the virus has left your body. They have also to observe COVID-19 prevention measures before they resume duty and even as they go back to work. Then also something else that will be happening is that for those that are returning from self-quarantine, they will be required to return only after 14 days of quarantine, just to be sure that if you had any virus in your body, it has already left your body or you have recovered. Then time away to be charged on sick leaves. That is, if you're in self-quarantine or you've been in isolation, that will be charged against your sick leave. Then for mental health and psychosocial support, it will be offered by the government to all public servants. Then also what we know is that the returning officers, people that are coming back from quarantine or isolation, will not be discriminated or stigmatized. And should that happen, then that has been termed as an offense by the head of the public service. And then finally, what we know is that for those that are holding meetings, online meetings for people that are more than 4 will be done. That is discouraging physical meetings of people more than 4. And then should there be a physical meeting, then people have to keep a physical distance of at least 1.5 million. Now, as we speak to the governors, there are a few pointers to this conversation. President Uhuru Kenyatta yesterday released a statement saying that there will be a summit meeting on Friday the 24th, and this is to assess the preparedness in the counties and evaluate the country's response to the pandemic. Of course, this is coming almost 21 days after the lifting of the cessation of movement in the 4 counties. And then the meeting will be evaluating the impact of the first easing of restrictions that were in place. So has it caused a spike in the numbers? Then also the meeting will review the efficacy of the containment measures still in place. So Speaking to us this morning is Dr. Alfred Mutua, who is the governor of Machakos County, as well as Governor Mutahi Kahiga of Nyeri County. Good morning, both of you. And let me begin with you, Dr. Alfred Mutua. So there's a meeting called on Friday to assess the progress and the achievements that have been made in the fight against the virus, and especially to do with the capacity. But before I do that, when you look at the numbers, now we're at 13,771 infections. This month of July, having recorded more than 700 new infections. Do you think the relaxation of containment measures has had an impact on these numbers?
I don't know. It's very hard to tell. From a research perspective, the numbers could just have been as a result of more testing, not necessarily of relaxing. But there has to be some percentage of numbers rising because of laxity. I mean, since the borders were open for Machakos, for example, our numbers are now up to 416. I mean, very quickly, over 200 people have now turned positive. But you see, we are also testing more. We are also seeing, the disease tends to grow before we can flatten the curve. So it's very hard to blame just the opening of the border, but it may have contributed.
Okay. And for you, Governor Kahiga, I know the numbers in Nyeri are just over 22, if that number has risen, because as of Sunday, Nyeri County had reported 22 cases. Do you think there's been any impact of the relaxation of containment measures, especially the reopening of travel from Nairobi to other counties?
Maybe. Good morning. Let me first say that the numbers are now, by yesterday they were 28. We currently have only 7 active cases. The rest have been discharged after turning negative, except for one young man who died. I think it was discovered he was positive when he was already dead. But the truth of the matter is that just like my colleague Alfred has said, we cannot per se say that it is really the cause, but definitely we have seen a sharp rise in the country and also in the county, because we were oscillating at I think 5-7 cases, and with the opening up, we have suddenly shot to 28, and it's looking like it's an average of 2 cases per day. I also agree we are doing a lot of testing. But I believe that the answer to this shall be more and more testing and isolation, so that we are able to isolate and control the spread. But clearly, we cannot ignore the fact that people have become more liberal in Nyeri. We have a very, very active, about 4 or 5 circles that travel daily to Nairobi and back. Nyeri is also a transit county. On anybody going to Isiolo, anybody going to Meru, majority of people going to Nanyuki must pass through Nyeri, Nyandarua, etc. So definitely we will not say that it's not the cause, but neither do we deny that it has really brought the spike in numbers.
Right. And Governor, the last time we spoke to you, you were talking about several things that you are going to do to improve the capacity in Nyeri County in terms of the isolation beds. So how well are you doing now?
Yes.
That's Governor of Nyeri. How well are you doing now? And also, when it comes to testing and isolation, have you boosted the capacity to test within Nyeri?
First and foremost, we are right in the midst of it. We are working to ensure that our lab can currently, we haven't started testing, but we are working on it. We are engaging and making sure that the lab is in condition and has the capacity to do the testing. We are still discussing on how to get about 10,000 testing kits. We are working on Mukurweini Hospital, which has 130 beds, to improve the capacity. And also we are struggling with fixing an oxygen plant. Mount Kenya, we have converted our outpatient into 40 beds. While we work on the inpatient and the isolation wards, we are reorganizing them and doing a bit of reconstruction. We also have the KMTC, which has 180 beds, which we are currently, those ones are ready and we are just waiting. Going further, we have already trained about 75% of our health workers, 1,305 of them. Today I'm launching the community health volunteers program, where we are equipping our 2,510 community health volunteers. We will be giving them kits. That is, we will be giving them a bag, we'll give them a jacket, and in the bag they are going to have a blood pressure monitoring machine. We are also providing kits that can help in testing of diabetes. We will be giving them sanitizers and masks to go down to the communities so that we can begin a community-based approach towards this pandemic.
Okay, I'll come back to you in terms of the capacity that has already been taken in the isolation centers. But Governor Mutua, so now you are way ahead in terms of boosting the capacity when you are launching that facility at the Kenyatta Stadium. How far are you now, and especially now that you see that 416 infections have been reported in Machakos? I believe some of them have already recovered. How much of capacity is already taken up by people that have needed to be isolated?
I mean, we still don't have many numbers in our health facilities. We have 463 beds in Machakos. We have just ordered another 150 beds. By Friday, we'll have about 615 isolation beds in the field hospital in Machakos, and spread all across. And we have ICUs. We'll have about 30 ICU beds in a week or two. So we are prepared. And we've been testing. As you know, Machakos level 5 is tests for COVID. We've already done 5,226 tests, out of which 65 from Machakos, that testing have been positive, which is about 1.3% of the tests within Machakos from our center. So we have about 95 people still ill, out of which 32 are in home-based care, and we are trying to tell people stay at home if you are positive, so that you don't strain the resources. But we are preparing for worst-case scenario. Right. I mean, we are thinking that if things start exploding, people start getting very sick, we are prepared. I'm working towards a figure of 951,000 beds, which is also very good for us. I mean, I'm listening to my friend from Nyeri, and it's music to my ears. He's talking about an oxygen plant. He's talking about some things that Nyeri had not done and may never have done unless COVID came around. So at the end of the day, even after COVID, counties are going to be that much better off in terms of health capacity.
And Dr. there is growing pressure on ICU facilities and even general ward hospitals here in Nairobi. I'm just wondering how much of the capacity, because you're saying that towards the end of the week, I believe that you should have 30 ICU beds. In the beds that you have currently, how many are already occupied by COVID-19 patients?
About two.
Only
about two beds, on two are occupied currently of our ICU beds. And, and I think that is the advantage. And we have to thank God in this, because realistically, when you look at the cases in Italy, look at the cases in South Korea, look at the cases in many other places, we've been very lucky. Majority of people are symptomatic. A very small percentage are getting to severe and critical, and a very, very small percentage are dying. So we are lucky, whether it's the factors, it's spread, or whatever it is, people are not falling very sick. The only problem is that when you look at the daily tests, we are getting a lot of people in their late 20s and early 30s are turning positive. But then within 10 days, they are cleared, they are healed. And so life continues. So as a country, we are lucky. Is
there an arrangement where, especially if Nairobi has more sick patients, they can be in a position to admit them at neighboring counties, including Machakos? Is that already a conversation going on? It's
a conversation, but I'm thinking that you look at the amount of resources given to Nairobi, even for the preparation, is way, way more than given to Machakos from the national government. You look at the resources that we have in Machakos is way less. Why can Nairobi get its acts together? You know what I mean? I know Nairobi is serving many people from all over, but when you look at the allocation of money given to Nairobi, it's given as per population and what it's serving. Let Nairobi get its act together. I mean, put field hospitals in Nyayo Stadium, put them in Kasarani the way I'm doing. Buy the beds, I mean, hire more health workers. So we don't want to start taking the burden of others. If there is laxity in Nairobi, don't bring that laxity. We don't want our people to to be burdened, because when you bring the patients to Machakos, it is Machakos resources and all that. So if a place is overwhelmed and they are trying, but they're overwhelmed, then we have to accept them. And I'm willing to accept anybody where you're overwhelmed. But if you're overwhelmed because you haven't done your job, you haven't put your act together, then why am I being burdened about it? I mean, it's as simple as that.
Oh, okay, all right, Governor. Let's take a look at what Governor Wycliffe Oparanya, the chairperson of the Council of Governors, said as far as testing is concerned. In a statement that he released on Wednesday last week, he said that that there is a challenge, first of all, to do with the testing. If you can take a look at the statement on testing, he said that currently the turnaround for results is increasingly being delayed from the initial 24 hours to 7 days, and this is not good enough in this war. So that was Governor Wycliffe Oparanya. And Governor Kahiga, so now the governor there is complaining that certain counties are having to wait until 7 days to receive their testing results. You said that you have not been able to test any person in Nyeri. You're still putting up your lab. How has the turnaround been in Nyeri?
Yes, I support my chairman. We have had quite a lot of delay. There has also been some inconsistency in the results released, which I think the MOH is addressing. But like I said earlier on, we will only win this battle when we test enough and as many as possible, and also get credible results. Why I say that is we have had cases where we have had two sets of different results on the same patient, on the same sample. So sometimes it's becoming a little bit boring. I almost think that Kenyans are just patient with us. They may end up seeking litigation where we seem to be getting a little bit confused. We have also had cases where the testing is, the results are given free, but some private labs are charging thousands of shillings. I think we need to get our act together. This is no time to start taking advantage of those that are less fortunate. But like I said, yes, we boosting our capacity, we want to ensure but that within the next 1 week we are able to do our own testing and can also give our own results.
Okay. Thank you. Okay, all right, Governor. So there's also a statement that in that statement by Wycliffe Oparanya, the governor of Kakamega, he also said, I want us to take a look at that, in his statement saying that in the event that the situation gets dire, individual county governments will have no choice but to, in consultation with the president, seek to lock down the affected county to contain the rapid spread and protect lives. So this is a statement that Governor of Nakuru, Lee Kinyanjui, also associated himself with. And Dr. Mutua, so the chairperson of the Council of Governors is afraid that the numbers are rising so rapidly and now feels that there should be that consultation. I know there's a meeting on Friday maybe to talk about such matters. Do you think it has reached that time that we need to review the relaxation of the measures that was announced on 6th of July?
I think it's going to be a catch-22. You know, we are looking at what is the impact to the economy and what is the impact of coronavirus? How many people are dying? How many people are projected to die? What is the impact collectively of the lockdowns in terms of our economy, and also which may lead to more death from other diseases and poverty-related crime and other things. So it's going to be a balancing act. I see where our chairman is coming from, because realistically the numbers have shot up. I mean, as soon as the lockdown was relaxed, which was expected. But the thing is the national government doing enough? I mean, our chairman is talking about testing and the turnaround. And let me just say here that the problem with the testing and the results is because of our Kenyan inefficiency system, our bureaucratic nature. I mean, with the way we do things in a very casual way. And I'm not playing politics here, but that is one of the reasons why I'm praying that God blesses me to take over this country, because we have to improve the way things are done. We do things in a very shambolic manner. In Machakos level 5, we do a test. Within 24 hours, even less, the test is out. You know, because what you're doing basically is that a test takes 6 hours to do. So from the time you collect...
Governor, I hear you clearly, but how did you get here? Because there are certain countries that are actually struggling. They don't have those testing facilities. How did you put in place yours?
It is basically investment. I started investing in healthcare from 2013. As you know, I bought the ambulances, I started building labs, I built community hospitals all around. So I've invested, I've hired over 1,300 health workers. So I invested heavily in healthcare because I saw it as a priority. And so we are reaping the fruits of the work that we did from 2013. So it makes it very easy. But also even that work, you have to ensure there is efficiency. My lab works, my lab technicians and my doctors work 24/7. They work in shifts. The tests coming 24/7. There's not this thing of collect tu mchana peke yake. So from 24 hours, we are collecting, we are releasing the samples, we are retesting, we are doing it efficiently. Because our target is that from the time you collect a sample, within 15 hours, 24 hours, you should have your result. So it's all a matter of how organized are you and what priority are you putting this in. So we've been lucky that way, and I'm happy that other counties can test. And so these are capacity that we can do. And we have the ability to do it. It's not difficult. It's not difficult at all.
Okay, all right. Of course, that was a statement from the Council of Governors speaking for the 47 governors. But Governor Kahiga, so now you are telling us about the isolation capacity that you're still working to ensure that you're able to boost it. I'm just wondering how much of that has already been taken over by maybe people that have been isolated or people that would be in quarantine at the moment?
Like I told you as I was speaking that we have only 7 active cases. Those are the only ones that we have in isolation. We have 0 quarantine. And we thank God, like Governor Mutua says, that majority of the people are turning out to be negative after 14 days. And we pray that this one will continue. Definitely all the cases we have had in Nyeri have been asymptomatic. There have actually been cases that walk in to get tested to be able to work in their hotels. But yes, like you say, I support Governor Kinyanjui. I also support Governor Oparanya. We must, as we try to balance between the two evils or the two goods, we must make decisive decisions and decide whether we will continue allowing our people to walk in and out. Yes, I was bashed 2 or 3 days ago when I said that I'll soon be asking the police to walk around our towns and use whips to tell our Kenyans that it's time to wear masks. Sometimes we have some very lackluster attitude, like Governor Mutua says, where people are hanging their masks on their necks, and this is just careless. We are working towards, our capacity currently is around 340 beds, but we have Odaya level 6, which has a capacity of 100 other beds, which we are just preparing. I think, yes, I'll be meeting the CEO of Kenyatta today. We are still progressing on the same, so we are looking at a bed capacity of almost 440, 450 in preparation for any eventuality. But we must continue to tell Kenyans that, yeah, you have heard Dr. Mutua say that he has a lab and has only tested 5,000. What does that one tell you? In a population of about 1 million, because I know he has about 1.3 or 1.4, 5,000 is a drop in the ocean. We as Kenyans, out of the 47 million, we have only tested less than 300,000. Like I have continued to say, we must increase our capacity to test. It's unfortunate that the countries that produce the tests, testing kits, are reluctant to release them to us, and we have to rely on the Chinese market. But really, this is something that we would call upon HE, the president, to intervene, use his goodwill, maybe seek friends like those in Germany that have almost managed to bring down their the spread through testing. So really, let us talk about testing. Let us invest in testing so that we test, get results, isolate, and then we'll be able to overcome this pandemic.
And so, Governor,
can I add on to what my good friend is saying?
Yes, quickly,
and I totally agree with him. And there are several aspects. I spent the last few days going around villages in Machakos County and looking at the laxity where people are not testing. I remember in one center, I was trying to get people to move away from each other, and they are very lackluster. And then when I talked to them about the loss and the demise of Papa Shirandula, they were shocked. And you saw all of a sudden everybody moved away because now it's hit home. Enforcement has been a major problem. Look at the curfew. As I said the other day, the curfew that the president has put in place is a suggestion, is not a directive. Because get out of your house anywhere in this country at 10 o'clock and walk around. You'll find people still driving. You'll find shops open. You'll find business going on. It's 10 p.m. We are not obeying the law because the law is not being enforced. We may need to get tough. The national government needs to get tough so that we may be able to curb this. Otherwise, it's going to be a runaway problem. Now, the issue of tickets, for example, yes, we are asking our president, and I agree with my friend, Governor of Nyeri, that we need to get more kits, but also it begs the question, why aren't we manufacturing our own? Maybe it's about time we got our act together. Like after Japan was bombed, within 30 years, they had a whole manufacturing and industrialization system. We are 60 years to independence, and we are still depending on kits from overseas. Let's get our act together. Let's wake up as Kenyans and say we need to do things better, and we need a change in the way we do things. Otherwise, 100 years from now, we'll still be looking for something from China, from Germany, from others, instead of taking care of our own. We need a shift. We need a revolution of the way we do things.
And so finally, as you conclude, Dr. Mutua, so come Friday during that meeting, should we advocate for staying open or return to lockdown? In a short answer.
I think it will depend on how committed the national government is in terms of enforcement, and what will lockdown bring in terms of being able to help our people who don't have food, who don't have resources, who don't have money. And so it is to be balancing out. But at the end of the day, as we said, it's better to suffer economically slightly but stay alive than die. So we have to balance all those things. And once we hear from the experts, then we can take a good decision.
And for you, Governor Kahiga, so comparing the impact the reopening has had on the economy versus the surge in the numbers, both nationally and at your county, what do you think we should do? Stay open or return to lockdown?
First and foremost, I want to appreciate that we have a president who is very, very alive to data and is consulting widely. That one is a plus for His Excellency President Uhuru Muigai Kenyatta. And therefore, even as we engage on Friday, I am sure we will have facts on the table, facts that we can use to make relevant and patriotic decisions for this nation. Like Dr. Mutua says, we are in between a rock and a hard place. We have an economy to look into and take care of. We also have our people to protect. But I will tell you this, that as far as I'm concerned, you can revive an economy, but you may not be able to bring back a life that is lost. And this is the balance that we need to get. We may not necessarily just wake up one morning and decide that we need to lock down the entire country. But really, if we have hotspots, we have to focus on them, close down and lock down, just to contain and ensure that all our resources are put into that. And I like the way Dr. Mutua puts it. I think we have to change our mood, our thinking. We must also change the way we are doing things as Kenyans. It is really disheartening to see that despite Waziri Kagwe's efforts and the national government, ourselves as counties, our people are still ignoring. The other day I drove from Nyeri to Embu, and I can tell you that as I was passing through some counties, I was shocked to see that people did not even have those masks that I see hanging on the necks of Nyeri people. They did not have any masks. And I think people must wake up from their slumber and agree that we have a pandemic right in our midst, in the villages, and we have to be very, very, very careful. We have to follow the guidelines given, and let's stop taking this thing as a joke.
All right, thank you so much, Governor Mutahi Kahiga of Nyeri County, as well as Dr. Afro Mutu of Machakos County, for making time for us to have that conversation. Just to note here that since the lifting of the cessation of movements, Machakos has grown in terms of numbers by more than 250. For Nyeri County, it has been about 21 increments, so they will be having that meeting with the President on Friday to review the progress made so far. Thank you both for making time for us. Up next is Comedy Tuesday with